Welcome to HiTap Podcast, brought to you in collaboration with Access and Delivery Partnership. Today, we will be listening to an expert's perspective, modeling for health. I'm Dimple Bhutani, your host for the day. We have the privilege of speaking with Professor Mark Jit, an epidemiologist and infectious disease modeler based in London. Professor Jit is the head of Department of Infectious Disease Modeling at the London School of Hygiene and Tropical Medicine. In addition, he wears leadership hat at various organizations, including being the co-director of Global Health Economic Center. His research interests include the use of mathematical models to inform policy decisions for the control of infectious disease, with a particular focus on vaccine-preventable diseases. Today, we will be discussing his experience in modeling before, during, and after the COVID-19 pandemic, his experience with communicating the complex model results, and with building capacity in low and middle-income countries. Lastly, we will also be revealing what the future holds for this field. Professor G, thank you for joining today.
Thank you very much for having me. It's great to be here.
Thank you. Before we begin, can you tell us more about your background, where you grew up, and how you got interested in this field of epidemiology and modeling?
Sure. Well, I actually grew up in Malaysia. Maybe you can tell from my accent. I moved to London in 1995, originally to read for a maths degree, but ended up doing a PhD and ended up working there. So I've actually been there ever since, and I worked in the UK, but with links in many other countries around the world. So how did I get interested? Well, when I was doing a maths degree, I sort of finished the degree and said, okay, I want to apply this to something that can really benefit people directly. And around the same time, I got an offer to do a PhD in mathematical biology. So that sounded really interesting, like, something really related to human beings, and sounded really exciting to me. So I did that, and sometime after I finished my PhD, an opening opened up to work in what was then called the Health Protection Agency, basically the National Public Health Agency of England, to apply mathematics to understand vaccination. So understanding what might be the health and economic impact of vaccines. And that sounded interesting. I applied, I got the job, and that's the field I've been in ever since.
Wow. So I could never guess that you were from Malaysia. So that's news. So you said that you have been working so long and applying the concepts of mathematics and relating it to vaccines and modeling. I want to ask you that since you have developed so many key models both before and during the pandemic, can you tell us a bit about how your approach to modeling has evolved over time, and how did your approach change once the pandemic hit?
Well, I wouldn't say my approach has changed over time. I mean, the infectious disease modeling field has probably evolved over the last, 20 or so years. There's been more emphasis on data because the data sources have got better. For instance, now we have contact survey data. 20 years ago, we didn't have much empirical contact survey data. There are a lot more data sources from surveillance, from testing. The computing power and some of the sort of mathematical and statistical techniques to take advantage of that computing power and the rich data sources have improved. So in that sense, the modeling has evolved, but I wouldn't say I've personally gone in a very different direction from the rest of the field. But during the pandemic, like most other people working on the pandemic, I think the main thing was that the pace of doing things, the speed at which modeling had to be done, and the stakes became really high. I mean, the decisions that we were helping to inform became really important, but the speed at which the results needed to be known, the timescales went from months to years to weeks to days. And so everyone really had to learn to work at that incredibly fast pace.
Yeah, I think my question down the line is regarding the pace in which you answered the policy relevant questions. But before that, I would like to ask you that what was the impact that you have seen at ground level that your work in modeling directly related to pandemic? Can you give some examples?
Well, I think modeling was both incredibly important, but much less important than some people think it was during the pandemic. The key thing is that I think modeling was really important because decision makers needed evidence to understand what was happening at that moment in real time. So, really, how many cases there were, since in most places, people could not detect every case, what might happen in the future, given different scenarios about what policymakers might do, how behavior of people might change over the course of the pandemic. And so this information became so important. And actually, because the field of infectious disease modeling had matured over the past 20 years, from the 2019 flu pandemic through the the response to other public health emergencies like the MERS coronavirus or Ebola, the field had really matured to be able to answer these questions quickly. Policymakers were able to rely or turn to modelers for this evidence. But actually, it's a lot less important than what some people think. I mean, I read sometimes articles or hear people say, oh, the modelers led to this decision. But the modelers are here to provide evidence to inform decision making, whether that decision was, by the governments of countries like the UK or other decision makers in other countries I was working with, or international agencies like the WHO. But ultimately, there are a separate group of stakeholders, decision makers, whether it's people like ministers, prime ministers, presidents, or expert committees that weigh the different sources of evidence and then inform these key, high-level decision makers. Those are the people actually making the decisions. But the evidence that comes from modeling is really vital to help them make decisions using as much information as possible.
Wow, that's great. I want to ask that how did you handle the pressure or the tension between the scientific rigor and timeliness of this modeling during the pandemic?
Well, I would say I was really fortunate to be surrounded by incredible people, both at the London School of Hygiene where I worked, and our collaborators in the UK and around the world, who, I mean, I think really gave a lot during these few years from 2020 to 2022. Lots of people who basically put their lives on hold in order to work really 24/7 for a long period of time to address these questions. So there was a lot of very intense work. I mean, there were definitely areas where we had to say, well, in order to answer this question quickly, we have to make these assumptions. We have to, we can't develop the most sophisticated model possible. So people said, why didn't you put this in the model? Yes, we could, but it would take another week. And actually, the decision makers needed the answer now, not in a week's time. I think the important thing when that happens was to make it clear that these are the limitations so that people know, okay, here's the result, but it's subject to these limitations.
So making clear the limitation of is an important factor in communication.
Yeah, especially when working very, very quickly. I think there was one more thing. There was also a lot of collaboration, which helped. So, I mean, during the pandemic, there was a lot of sharing between investigators and even between different groups, different institutions, because everyone knew actually the world was up against a huge threat to human beings. It wasn't about, who's better or who's worse. It was really about coming together and doing what we could to help this.
So do you think that now, since the COVID-19 pandemic, the urgency has cooled off, that collaboration and that sort of communication still exists?
Well, I hope that, the experience of working together on such a major threat to humanity has, formed bonds and a common understanding that actually we need to work together between teams and even between countries. I hope that's been true at every level, whether it's, at the national decision-making level or the scientific level or the level of modeling teams in different countries working together.
Mm-hmm. Working together, yeah. This also reminds me that you have played an important role in building capacity and working together in collaboration with several lower and middle income countries and several organizations. In Thailand, particularly, you have worked closely with HITAP to enhance the capacity of researchers and policymakers in conducting economic evaluations and making evidence-based decisions. as well. Since 2013, way before the pandemic started, you saw this potential, and this has been your field for clinical practice research. You have also run several courses in collaboration with National University of Singapore and more recently with HITAP on vaccinology. So my question is, what motivates you to help LMICs in building their capacity, and what have been your approaches in building capacity?
Well, first of all, I'd say it's really an honor and a privilege to be able to work with organizations like HITAP in Thailand and many other organizations in different parts of the world. I think one motivation for me is personal because actually I grew up in this part of the world in Asia. Actually, I did want to be part of the journey that countries in this region are taking to strengthen research capacity and to inform decisions that really can make a huge difference to the lives of many people. I think another reason is because I really believe that the health of everyone affects us all. I mean, we saw that during the pandemic. We can't say, I don't care what's happening in Europe or I don't care what's happening in China or in the US. What's happening in every country affects every country in the world. But I think that's true of so many health problems. And so I think when we cooperate, when we work together to strengthen each other, everyone benefits. So I think it's less about, am I going to work in my own country or another country? Am I going to work in a low or middle income country or high income country? It's more that everyone needs to come together to share our knowledge and resources so that we can learn from each other wherever we are.
So, as you said, that since you grew up in Southeast Asia, and that was the biggest motivating factor for you to pursue your interest, if I were to ask you, what advice would you give to a young researcher who is living in some remote part of the Southeast Asian region? If he were to bring the stakeholders together to build capacity in his region, what would you advise him? How should he pursue this?
Well, I think one thing I'd say is that I think in the long term, really bringing people together is very effective in terms of collaboration. And I think multilateral collaborations I've seen are often more effective and sustainable in building capacity than just two-way collaboration. So, because, often many teams in many countries can come together and share resources and share learnings together. So we've seen a lot of successful examples of that. For instance, I'm thinking in the PAHO region in the Americas, the PROVAC initiative has really brought countries together from that region to say, well, let's build our technical capacity in making vaccine decisions together. So, we will, as a region, we will organize workshops for each other. We'll, develop tools together and so forth. WHO has played a role in, putting together multi-country consortia around things like, for instance, during COVID, around the COVID modeling, bringing many different teams together. There have been incredibly important efforts by regional health organizations, Africa CDC, the European CDC. And I think this allows countries to really pool their resources and sometimes maybe even say, well, let's develop one model framework and let's use that across many countries so that countries can adapt it, they can build upon it, but actually we don't need to reinvent everything separately. So I think part of building that collaboration, bringing stakeholders together, is to bring collaborations of all kinds, whether it's within a region, whether it's across regions, whether it's north, south, 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 whatever it is. I think there's room and there's importance for all these kinds of collaborations.
True. Bringing collaborations of all kinds. Yeah. So moving forward, as you know or may have heard, that WHO recently declared that the public health emergency for COVID-19 pandemic officially ended. So now, as we are in the future or the post-COVID world, as we look to the future, what do you see the most significant challenge in modeling infectious disease now, and how can we work together to address them?
Well, I think the COVID pandemic was already a huge challenge. I mean, I talked a bit about how policymakers actually realized that there was a lot of important information that they could get from modeling to inform decision making. So we saw modeling become quite prominent in informing these decisions. And we also saw policymakers needing very detailed results from models to inform policy in real time. So not saying, can you analyze this data and tell me in a few months what the best options are, like we would do outside of pandemic times, but really saying what's happening now and what should we do in a week's time. And so, as I said, we moved away from a paradigm where we do work over weeks or months to, going to one where we did it in a few days. And I think this really demonstrates the success of modeling in a sense that our capacity, both the technical capacity and maybe things like computer capacity, has grown to the extent where we can use those models and put them together to run much faster than before. So I think one of the challenges will be to be able to continue to do that, because pandemics are not going to end, health emergencies are not going to end, but it does require investment, both in the technical capacity. So if you're going to ask people to, produce results every week for months and months, it can't be one or two people doing that. That's like not sustainable. It has to be a team where people can, step in for each other and so forth. Investment in surveillance, in data pipelines, in decision-making capacity as well. I mean, I think in terms of wider challenges, one thing that I wouldn't say COVID has made us realize, but hopefully it's just reminded us, is that infectious diseases are not going to go away. Maybe like 20 or 30 years ago, there are a lot of people saying, well, infectious diseases are on the way out. It's all about non-communicable diseases now. That's a huge problem as well. Non-communicable diseases, especially in low and middle income countries, are becoming more and more of an issue. But infectious diseases in every part of the world remain a huge challenge. There will always be new emerging infections. There will be more pandemics. There will be new threats like antimicrobial resistance, like even resurgences of old diseases like measles as a result of challenges in maintaining vaccine coverage. So I think a lot of the challenges will be, really being able to cope and address these major infectious disease health challenges effectively.
I would like to believe that COVID-19 gave us an opportunity in which we adapted ourselves, and hopefully we continue to go ahead with these challenges. Are there any new technologies or data sources that you think will revolutionize the field of modeling?
I don't know about revolutionize. It will probably be continuous incremental improvements. Maybe, I said the infectious disease challenges are huge and will continue to grow. We are coming up with new technology that will help us in this, to fight this threat. I mean, for instance, in the area where I work, new vaccines are being developed, like vaccines against RSV have just recently been licensed. mRNA offers like new possibilities for, new vaccine formulations. There'll be new surveillance methods like, genetic surveillance and new strategies that we can use. So I think part of it will be being able to evaluate these and also do it as well and as quickly as possible to inform decisions about these technologies, and even doing it early so that they can guide not just when the technologies are developed, but even at the development phase, how, what are the most useful technologies to develop. I think in terms of technologies in modeling itself, maybe this is a bit more speculative, but I think already increased computing power has really improved the field. It has made possible ways, for instance, of bringing data to models that we couldn't do in the past, so that models can actually take into account lots of data sources together quickly, including the uncertainty in those data sources, which was very difficult to do in the past because the computing power wasn't great enough to use these sort of highly computationally intensive methods. In the future, maybe possibly AI will make a difference as well. That's the buzzword now. I think it might be less about radically changing the way we build models. I think it won't be an issue where we just throw lots of data at, an AI model and then it'll come out with the answers and we don't know what's going on inside. Because I think policymakers, and not just policymakers, but other scientists will always want to know, well, has this model taken into account, the biology, the immunology, the epidemiology of the disease, the way human behavior works? So there'll always be a need for mechanistic models, not just, not simply data processing. But I think AI probably will make a difference in terms of the way we code models, maybe making more automated generation of code possible. So, if we've, built a 1,000 different models of this kind, computer might be able to suggest, if you want a model of something that's only slightly different, here's some code you can start on. The end result might not look different, but it might enable us to do it very quickly. It might also improve things on the front end, because maybe in the future, the policymaker might be able to say, actually, I want to add this feature to the model, or I want to take into account this new data source, or, in my country, things work slightly differently. And maybe that could be done much faster as a result. So those are some possibilities. But I think part of it is also making sure that actually, the technology gets disseminated, the expertise gets disseminated, so that countries can continue to build on their existing capacity and improve as the field continues to develop.
Wow, this really piques my interest. And now I'm inclined to ask you a little bit of controversial question. Based on what you said about AI, it is pretty clear that it has definitely a futuristic benefit. But what is your personal take on researchers using AI for their work? How they should pursue this? Should they use it or should they not?
Well, I think I'm not going to comment on things like sort of large language models like ChatGPT, because that's not my field of expertise. So I wouldn't want to comment. But I think in the field of infectious disease modeling, there's definitely potential in things like talked about, like making coding and model development faster, and maybe in terms of the front ends. I think that there will always be reluctance in really, building AI models that sort of replace the mechanistic models that are built by human beings. And I don't think we'll go to a science fiction world where the policymaker will just say to the computer, take a look at what's happening in all the data sources in the world and tell me what to do, and then just take the advice. The policymaker will always want to know, what are the assumptions behind your model? I want to change this assumption. Has this been tested? Tell me what's going on here. And that's the kind of thing that you actually need, a sort of a mechanistic model, a model where actually you can say, well, this part of the model represents our understanding of this part of, say, human biology or immunology or so forth.
So there's no threat to humanity as of now.
Well, humans can always invent new ways to destroy ourselves, and have always tried to do so. But I think anything beyond that is speculative.
We here have a room full house, and we have particular questions that has been asked by a lot of the young researchers. So let me ask you this: what advice would you have to give them, to young researchers who are interested in pursuing a career in epidemiology and modeling, and what qualities should they have to be successful?
Well, first of all, it's super exciting that people want to pursue a career in this area, because it's a great field to be in, and I'm excited that there are, young researchers interested in it. I think the main thing is to remember, epidemiological modeling, infectious disease modeling, it's an interdisciplinary field. So really you have to love all the parts of it to some extent. So you have to be interested in the more mathematical side of it, the equations, the statistical techniques. You have to be interested in staring at lines of code all night. Sometimes it's about that, but also interested in the underlying, the biology, the epidemiology, the way human behavior works, the way human beings interact with each other, the way countries make decisions. You can't just treat it as a maths problem. And also, I hope that people entering the field are also interested to help decision makers make good decisions and to save lives, because it's not just an academic exercise. We're doing it ultimately because we want to make the world a better place. And I hope that will always be our motivation.
That's really good to hear. I hope that the young researchers who are listening to this podcast can definitely with them. So before we close, can you tell us about any projects that you are working on, and what can we expect from you in the future?
Okay. Well, for the last few years, my team was focused almost entirely on the COVID-19 pandemic, like most other infectious disease sort of groups in the world, because that was the greatest infectious disease challenge in at least my lifetime. We are now pivoting away from focusing on COVID-19 alone, although that's still a really important stream in our work. And maybe, in a sense, going back to the previous work that we were doing, which covered a range of vaccines. But at the same time, there are a lot of exciting developments in the vaccine pipeline. I mean, the new vaccines, like I said, against RSV have just been licensed. Vaccines further on in the pipeline, which probably will hopefully be saving lives within the next decade. Improved influenza vaccines against maybe Group B streptococcus and so forth. So we've been looking at some of those. There are also developments within existing vaccines, like the use of maybe microarray patches, which can really help to bring vaccines to populations which are quite hard to bring vaccines to at the moment. Sort of new evidence that maybe that reduce dose schedules for some vaccines, maybe PCV or HPV might work as well or almost as well as existing schedules. And that really opens up many possibilities in terms of strategies that can reach more people and save more lives. So all these things are things I'm excited about for the next few years.
Wow, this really makes us excited as well. Thank you so much for sharing your thoughts and expertise with us today. It has been really a pleasure speaking with you, and we appreciate your contributions in the field of modeling and building capacities in lower and middle income countries. We look forward to seeing your continued work in this area.
Thank you very much for having me. It's great to be here.
Thank you. For our audience, thank you so much for listening to this podcast. If you're keen to learn more about the mentioned vaccinology course, we have some exciting news for you. Experts from the London School of Hygiene and Tropical Medicine, the Saucy Hawk School of Public Health, National University of Singapore, and the Health Intervention and Technology Assessment Program HITAP Thailand have collaborated to prepare a curated course on vaccinology for clinical and public health practice for researchers, academics, and/or public health professionals. This is an annual workshop run in collaboration with other partners since 2013. And it aims to bring deep and complementary experience in training, capacity strengthening, clinical and policy-relevant research in the field of vaccinology. And this year, this workshop was held in Bandung, Indonesia from 15th May to 18th May 2023. And we collaborated with Pajajaran University. This workshop had faculties from several institutions in Indonesia, UNPAD, LSHTM, NUS, and HITAP. The workshop was also supported by ADP with the support from Biopharma. For more information, you can visit our official channels on YouTube and Twitter, or you can visit www.hitap.net for more information. Thank you, stay healthy, and stay safe.